time, which is fantastic news for all families involved and for all people involved. A lot of people are asking us, how long is recovery going to take? When will the airlines be back? When will the people travel again? Well, I have to say that will take a little while. This is fantastic news, and it's a very good start, and it's more than a glimmer of hope. It indicates that there's light at the end of the tunnel, but the recovery is going to take 3 to 5 years to be back to pre-COVID levels. The reasons for that are that initially still there are large parts of the globe where people cannot travel freely into Australia. Up until the moment that visitors, and that's for leisure reasons or business reasons, can travel freely to Australia, we will see relatively low passenger volumes. But they will increase compared to today. The second reason is, for now, Australians cannot travel to all countries in the world. The most important markets for Australia, the most important markets for Brisbane Airport, New Zealand, China, Japan, India, Singapore, and even Bali are still very difficult to travel to. But that will change, and that's all good. So if that changes, if we will be able to welcome visitors back into our country, and at the same time we will be able to fly freely to those other markets in the world, we will see recovery happening. Most important thing is consumer confidence. People need to be confident to travel again, but I'm sure that that will happen. So up until yesterday, we saw about 500 international travelers daily here at Brisbane Airport. Today, that's already more than 1,000. So that's double the number we had, which is great news. But it's still a long way to go before we reach the 17,000 we had before COVID. But we will get there. We will definitely get there because we're very well positioned worldwide to welcome all those travelers back to Brisbane. And I know that my friends, people I work with, they're really keen to travel out of the country again as well. We're very well positioned as Brisbane, as Queensland. We've got a beautiful state to visit, but we need to work hard and collaboratively to make sure that our airline partners are coming back to Brisbane. Before COVID, we had 29 airlines flying to 34 destinations. Today we've got only 10 airlines flying to 11 destinations, and some of those airlines are only flying freight. So again, we need to work really hard with Team Queensland to get all those airlines that were flying to Brisbane Airport prior to COVID back again. I said that's a collaborative effort that it requires, Team Queensland. And therefore I've asked the Minister and his team at State Government to work with us and to co-fund a campaign to get those airlines back into Brisbane. Long story short, we're very excited about what's happening today. We saw the first quarantine-free flight arriving just moments ago. That was an Air Niugini flight. We will see a flight of Singapore Airlines in a few moments coming out of customs as well, which is great news for all people involved. Few more things that are happening that are really positive. We will see Emirates Airlines increasing their operation from the 2nd of March and bringing back the A380 in July. Singapore Airlines adding 3 daily flights in February. And Fiji Airways will restart their flights tomorrow. And a little bit later in this conference, I will give John Nicol the opportunity to answer a few of your questions. He represents Fiji Airways here at Brisbane Airport. So thank you all for being here. Thank you all for being part of this glorious moment for Brisbane Airport and for our industry. And thank you all. I'm happy to take questions if you have them. Without further ado, I would like to invite Minister Stirling Hinchliffe to say a few words as well. Thank you.
Thank you, Kurt-Jan, and good to be here with you, John Nicol from Fiji Airways. It is wonderful to see today the international borders being reopened in such a way that allows for that free movement for vaccinated individuals to be able to come into Queensland and not have to go into any form of quarantine. It's really positive that we'll have these first flights here today, here at Brisbane Airport, and we'll see over the next week flights into all of our international airports throughout Queensland are receiving passengers and seeing them reuniting with family, getting back to their studies or getting to work, and hopefully soon we'll see a lot more tourists, making sure that we can see this as the real light at the end of the tunnel for the Queensland's $6 billion tourism industry. But most importantly, I'm very focused today on welcoming those people, particularly on that first Singapore Airlines flight, welcoming those people who'll come in and might be students, some of the 30,000 people enrolled in Queensland universities and institutions who can return to face-to-face studies. That's a really welcome opportunity, and doing that without having to quarantine is very, very welcome for those institutions and for those students. And that's very importantly good news for the whole of the Queensland economy, because of the very important role that international students play in our workforce as well. So for those particularly businesses in the hospitality industry that have found it difficult to maintain operations with staffing levels, this will be a welcome boom for them as this redevelops as well. I concur with Gert Jan's commentary about the way in which this will be a slow rebuild for our tourism industry, but a very welcome one. And this is the thing that provides the confidence for allowing people to look forward, to invest, to make sure that we're ready for the opportunities as they rebuild. But they won't rebuild immediately, and that's where we need to work together. And I welcome Gert Jan's approaches and the approaches of others in the tourism industry to work with government. And we need to work closely across the whole of Team Queensland, indeed Team Australia, to rebuild our tourism industry right across the state. So happy to answer any questions around the tourism industry at this point before we go into our COVID brief in a short period of time. Well, when we see the borders opening to those markets that make that possible, finally that will be, in terms of those different markets, that will be a matter for the Australian government about when we open up to some of those different markets. But I'm very hopeful with markets like Singapore to start with, that we do see tourists return. The first blush of these international arrivals taking advantage of vaccinated arrivals not being able to quarantine will be reuniting of family and friends, and that's very welcome, students and workforce, but we will see tourists coming soon, and that'll be a really welcome thing for those, particularly those parts of the Queensland tourist economy that have been so impacted by the international border closures for so long. That's part of the process that the Queensland Police Service will be managing, and they do spot checks around those sorts of things. It is certainly a requirement for people to make those declarations upon their arrivals and in coming into the terminal, and they're matters that have been administered by the Queensland Police Service.
How much money has the tourism industry lost because of COVID, and what are your projections? I know you say it's a slow build, but what do you think the next year will bring money-wise? How will it recover?
Yeah, look, we haven't fully modelled those things at this point. We're working closely with the tourism sector and more broadly across the sector and our government agencies like Tourism and Events Queensland to work on how we work closely with the sector to rebuild that international marketplace. We've done a really great job at sustaining so many parts of our tourism industry in Queensland through domestic travel. That's been very important to our sector, but the international borders reopening is a great opportunity, and we want to see that rebuilt further, particularly for those sectors that have been very focused on that international economy and those international tourists.
Queensland has 4 of the top 10 destinations in the world in a recent survey. Sunshine Coast, Whitsundays, Noosa and Cairns. This new report from the Tourism Sentiment Index. What's your reaction to this, and how good of an influx of visitors will it be for those areas with international borders opening?
Well, I'm not surprised at all, because Queensland, of course, would top the polls as being one of the best places in the world to visit, and one of the places that people have a great desire to. So we want to build that desire, build that capability of responding to it, and make sure people get to enjoy the fantastic places and experiences that we have to share with the world. Those destinations are right up there with them. I'm just surprised it's not 10 out of 10.
Even though people arriving here are double vaxxed, some of those people will inevitably be sick and want to build and require hospitalisation. Isn't that then putting an extra strain on our health system?
Obviously, the screening processes that are put in place and requirements are the best possible measures that we've had in place. This has been done on the basis of the public health advice, but we don't see this as being a great burden on the nature of of our health system. We've heard already from Gerrard that those numbers are modest compared to the usual international inbound numbers. At this point in time, we don't expect that to grow massively quickly, as Gerrard has attested to as well. We know that this is something that's going to positively impact on our community and our economy, particularly that family and friends being reunited.
Just on another issue, sorry, on the P-C-C report. You obviously read that report. Does Alan Foreign still have your confidence?
These are matters that the Premier addressed yesterday, and we'll be discussing that as a government in the very near future, and I look forward to contributing to that.
Or what's your own view?
I think it's a matter that we need to discuss as a government, and I look forward to discussing the report. Okay. John, did anyone have any questions for John Nicol from Fiji Airways before we go on? John.
Yes, we're happy to advise that as of tomorrow, we've got a full ship coming in from Nadi, Fiji. Then moving forward, we've got in February and March 5 flights a week between Brisbane. Brisbane is a very important market for us as well. Hence the reason why we're jumping to the opportunity so quickly. So 5 services February, March, and then as from April, it'll be daily services. Tomorrow it will be mainly citizens returning. They've been waiting for this time to open, so they are coming tomorrow. February and March we're looking at tourists, combination of tourist and VFR market. Yeah.
Tell about your campaign.
Sorry?
Your campaign.
Oh, yeah. We've got, to introduce these services, we've got some fantastic offer in market now. We've got a 3-day sale right on now to coincide with the opening of Brisbane. Packages have been reduced by about 70%. It won't last long, so grab the opportunity while it's there. Okay. Thank you. Thanks.
Thanks, John.
Any questions for me? Yeah, that's just a worldwide, global estimate of how long it will take for the aviation industry to recover completely. Again, what I said, still there are a lot of restrictions worldwide that prohibit travel or make travel really difficult, and will make travel a little bit more expensive. So that's an important factor. Second is we don't know if all economies, if all airlines will come out of COVID and the COVID pandemic in the same shape as they were before. And the third is it will take a while to rebuild consumer confidence and make people traveling again. So that's why we believe that it will take about 3 to 5 years for the aviation industry to be back at 2019 levels. Hopefully I'm a little bit too conservative, hopefully I'm a little bit too negative, but that's worldwide the idea that the gradual improvement of our or recovery of our industry will take that long. Thank you.
Thanks, Mike.
Thank you.
Yeah. I think the Chief Health Officer we're going to slightly reset. So after talking about the opportunity of seeing the international borders reopen and what that means for the Queensland's economy, it is important that we continue to update the community around the impacts of the pandemic. Today I can advise that there have been 15,050 new cases reported to Queensland Health, and very sadly there have been 10 deaths in the last 24 hours. This is terrible news for the families and friends of those that have been affected by those deaths. Can I pass on my condolences and condolences to the government? I think you don't want to hear from me any further. I think we'll hand over to the Chief Health Officer for a more detailed report and to be able to, between he and I, answer any questions you have.
Thank you very much, Minister. Sadly, we have 10 deaths to report today. One woman in her 40s, one person in their 50s, 6 in their 80s, and 2 in their 90s. Of these, 1 was unvaccinated, 6 had received two doses, and 3 had received boosters. In terms of hospital care, we now have 884 people in hospital being treated for COVID-19, which is up from 855 yesterday. And this includes 52 patients in intensive care unit, which is actually down a bit from 54 yesterday. Of the 52 patients we have in intensive care today, 18 of them are on ventilators. But perhaps the most positive news in the last 24 hours with regard to COVID-19 is the fact that the pandemic, or this current wave of the pandemic, has clearly peaked in New South Wales. It has clearly peaked and is turning the corner in New South Wales, just over the border, just a relatively small distance from here. The modelling we have for Queensland is very similar to the modelling used for New South Wales, and so we are still very confident in our current modelling of what is going to happen globally with Queensland. We're about 2 weeks behind New South Wales in terms of the pandemic wave. That's globally for Queensland, although we expect the pandemic to affect different areas at different times. The Gold Coast, for example, is ahead of the rest of Queensland, and it could be as early as the next few days, sometime this coming week, when the pandemic will peak on the Gold Coast. And then metropolitan Brisbane is likely to follow maybe a few days or a week after that. That is our current projections. Now, I would remind everybody that we are talking about a peak. The peak is not the end, the peak is the high point of transmission, and high points particularly of admissions to hospital. What will then happen over the ensuing weeks is that the number of cases is likely to fall at about the same rate as it is risen, although a slight caveat on that is that with the opening of schools, there's likely to be some more transmission associated with the return to schools. But again, I just want to emphasise this is very definitely positive news from New South Wales, that they have clearly reached the peak of the pandemic wave there, and they're modelling very similar to ours. So overall, Queensland was likely to reach its peak about 2 weeks after New South Wales, and we're likely to see the peak in the Gold Coast, first of all, probably sometime in the next 7 days, and we're looking very closely on a day-by-day basis at the data coming out of the Gold Coast. Thank you very much.
Just on the check-in app, how many times has the check-in app been used to notify people of super spreader events?
Look, I know people are very concerned about the check-in app. We don't want to change any of the public health and social measures until we're over this current wave. So we have that in place. We're not going to change it until we're over this wave. We will then review all our public health and social measures at that time. The check-in app is certainly extremely useful for identifying your vaccination status, and we also is a record for yourself of keeping where you have been, a notice of where you have been, particularly if there have been super spreader events. But we do not want to start changing public health and social measures right now, just as we're about to approach our peak. We'll look at all of this after we've passed the peak. I can't tell you specifically in the last couple of weeks. I can't tell you that specifically. But I really must emphasise, We don't want to start stopping the measures now, because then if we did for some reason have to put them back in again later, this would be very difficult. This is New South Wales, for example, withdrew their measures a bit early. We don't want to be doing that. We don't want to be changing things right as we're approaching the peak. We'll review all of this in the next couple of weeks, 2-3 weeks. This is not the time to be changing these. What we are doing at the moment is, we believe, is working, and we believe that we are going to reach our pandemic peak for Queensland in general in the next couple of weeks. Now, this will not be uniform across Queensland. As I mentioned before, Gold Coast is likely to be the first, followed by metropolitan Brisbane, perhaps Cairns, then more of the regional centres are likely to follow sometime after that. So it won't be uniform, but the news from New South Wales is certainly very positive.
Is that potentially there could be more transmission around school going back? Would you call that another peak? And what's your thoughts around potential peaks?
There definitely will be transmission when schools return. We all know that. Any parent knows that as soon as schools return, there's transmission of whatever virus is going around. Whether it will be an equally sized peak or not, I don't think we know that yet. But it does, again, affirm, and it affirms the decision to delay the opening of schools until after the projected peak, which was exactly when the schools were going to open. So schools were going to open next week, which is when we expect Gold Coast to peak, and then Brisbane shortly thereafter. So I am very confident that the decision to delay the schools opening by 2 weeks was a very sound public health measure.
Is it fair to say with that at least another 2 weeks, potentially at least a month before there's any consideration?
We'll review it. We're reviewing it. We will review it as it is clear we have passed the peak. This is not the time to be changing public health and social measures.
And in terms of the definition for the super spreader event, I mean, what does class as a...
We are not changing anything for the moment. We just the application is there. We are not going to alter it as we approach the peak. This is not the time to be making significant changes in our processes.
And it's not the same for the vaccine mandate. There won't be any entertaining of easing that vaccine mandate until after we pass the peak.
Oh, I think there won't be any entertainment of easing the mandate for some time. We've got to be clear that this pandemic is under control. What happens going forward after this wave, that is not clear. We don't know. We will always plan for the worst and hope for the best. So it is conceivable that there might be another wave in the wintertime as the weather becomes cooler. There may or may not be, we don't know. But I would certainly be planning for that. We are certainly planning for that in Queensland Health, even though it may not happen.
There are protesters that are meant to be out today, and I'm sure they'll make mention of the fact that once we got to a certain rate, the restrictions was supposed to ease. What's your message to those people out there who aren't vaccinated and are hoping to get their freedoms back?
Unvaccinated people are putting their lives at risk, and they're putting the healthcare system at risk on a day-by-day basis. Unvaccinated people are very clearly overrepresented in our hospitals and our intensive care units. If you're unvaccinated, you're 24 times more likely to end up in intensive care units in Queensland at the moment. No, it is a very bad idea not to be vaccinated at the moment as we're approaching the peak of a pandemic. Sorry, I don't have that information specifically. I mean, as more and more people get vaccinated, as the majority of the population get vaccinated, you will see many of the deaths and hospitalisations will be in vaccinated people. That's just because of the proportion. But the probability of dying or of ending in intensive care or in hospitals is very substantially higher if you are unvaccinated.
There's some upsetting stories coming out of maternity wards. The latest one being a woman's baby was taken from there to very low likelihood of her actually having COVID.
Yeah, look, I'm very sorry if this. I read the story this morning. I'm very sorry if this lady had a bad experience in one of our hospitals. We do have we have a lot of mothers with COVID or suspected COVID being managed very successfully in our hospitals, and our policies very solidly that the baby stays with the mother. There may be some specific circumstances where a baby may be separated from a mother with suspected or confirmed COVID-19. For example, where a baby may have to go to the neonatal intensive care unit. That's a sort of, and then there may be a time when the mother needs to be separated. The general principle, though, is mothers and babies are not separated in our hospitals. We've been managing quite a few mothers with COVID-19 and suspected COVID-19. Pregnant mothers can have support people with them, yes.
That was just changed yesterday, is that right?
It was clarified yesterday, yes.
Is there some
What was the other place to start?
Oh, I think it was just a question of clarification. I mean, it was really just clarification that mothers could have a support person in with them. It was because of we're talking about, this is positive mothers with, again, just a clarification, because different hospitals were doing slightly different things. It was just a clarification in the direction.
So is there a one rule for all, and are you certain that everybody understands?
There are very clear guidelines, very well written guidelines and clear guidelines on the management of mothers in Queensland hospitals. You can Google it yourself. It's very clear and very well laid out that I think other jurisdictions have actually copied. So as far as I know, we are reaffirming with hospitals that they follow those guidelines, but I think all maternity units are very well aware of those guidelines. Now, if this mother had a bad experience, I'm very sorry. I'm sorry. I'm sad for that, but there may have been specific circumstances. Say, for example, if the baby had to go to an neonatal intensive care unit. But as a general principle, mothers are not separated from their babies in hospital, even if the mother is positive.
One question about vaccinated. There might be some people out there that are hearing the message that we're heading towards our peak, and perhaps they might decide that they don't want to get vaccinated because we're nearly past the peak. What's your message to them in terms of we're nearly past that peak, and why should they get vaccinated?
Because the virus, and I'll say that again, because the virus is not going to go away. The virus is going to be with us probably forever. So if you're not at some point you're either going to have to get vaccinated or you're going to get infected. It's going to be with us forever. So you won't be able to hide from this virus. It's going to continue to circulate. But what is happening now is we have an increasing amount of immunity developing in our community, both mainly from vaccination, but also from natural infection. And so the virus is likely to continue to circulate in small quantities forever, for years to come. And anyone who is non-immune will continue to be susceptible.
Can I just ask just on
Yeah.
that point? So
Yeah.
if somebody who maybe has had 2 doses of vaccine
Yeah.
contracts the virus,
Yeah.
so they've got an increased level of immunity that just contracts
Yep.
the virus, do they need a booster?
We recommend that they have a booster because there is evidence that the booster gives you a better immunity than natural infection, but that is the current recommendation.
Sorry, one question. With international arrivals coming, obviously they're double vaccinated, but some of those people are going to be infected and will probably need to go to hospital at some stage.
Some.
Will that
It's a very small proportion. It's in the scheme of the number of people that are infected in this country at the moment, which is probably in the millions, the number of people who are actually being hospitalised is tiny. It's just that we have a very small proportion of a very large number can give you a large number. So any vaccinated individual's probability of ending up in hospital is very small. So I'll say that again, any vaccinated individual's probability of ending up in hospital with COVID-19 is very small. It's just at the moment we have very large numbers of people with COVID-19 in the community. In Queensland, for example, we have confirmed diagnosed cases of COVID-19, about 250,000. So, say that again. In Queensland, since opening the domestic borders, we have confirmed cases of COVID-19 numbering about 250,000, about around that number. The real number is substantially greater than that. It's a very large number. It's almost certainly greater than 1 million. We don't know the true number because not everybody's getting tested. either because their symptoms are mild, they don't recognise the symptoms, they don't seek to be tested, or they can't get access to a test. That's the other thing. So an individual's probability of ending up in hospital if they are vaccinated is tiny. That's much greater if you are unvaccinated. It's interesting, what we're seeing in hospitals with the unvaccinated, it looks like COVID-19 from a year ago. So the average age of someone who is unvaccinated being admitted to hospital with COVID-19 is about 20 years younger than somebody who is triple vaccinated. So it's like old-fashioned COVID that we thought we weren't going to see again from a year ago. So that was the pattern from, well, mostly overseas, not in Queensland. I'm talking about overseas and Melbourne, New South Wales. And I was in a COVID unit overseas where we saw this younger age group being treated for severe COVID-19 before the vaccine was here. In this vaccination era, it's a different pattern. Mostly it's the older and people with underlying immune problems. More vulnerable people who are more likely to be hospitalised. Not universally, we still see we do, as with everything in health, in biology, that it's variable. We still do see some young people ending up in hospital, but for the most part, in this vaccination era, the vaccinated are mostly the more vulnerable and older population, whereas the unvaccinated we're seeing are younger and just younger and healthier people. About, on average, the average age of an unvaccinated person in our Queensland hospitals is about 20 years younger than someone who is triple vaccinated.
So you're not worried about the next year's Australian health system then?
The international arrivals, no, relatively, they'll all be double vaccinated, and the numbers compared to the size of the population is small. I'm not concerned at all about it.
Just saying the average age of an unvaccinated person is 20 years younger.
Yes.
What is that age?
I think it's around 39. Something that's on average, but there's a standard deviation. But I think it's around 39, something like that.
Thanks, everyone. Much appreciated.
Thank you.
That's it. You're kind of back.